Hey, it's working. Took a while. Okay, this is part 2 of Focus Review Test 4 for Nursing 240. We left off with the cataracts, the cerebellum, and what it affects. Well, it affects your balance and your coordination. Chronic otitis media, that is characterized, I thought we already talked about this. I talked about acute otitis media. This is chronic. It is characterized by a purulent exudate and inflammation that can involve the ossicles, auditory tube, and mastoid bone. It's often painless. Hearing loss, nausea, and episodes of dizziness can occur. Hearing loss is a complication from an inflammatory destruction of the ossicles, a tympanic membrane perforation, or accumulation of fluid in the middle ear space. A mass of epithelial cells and cholesterol in the middle ear, called cholesteatoma, may occur. The cholesteatoma enlarges and can destroy the adjacent bones. You're going to want to do a culture and a sensitivity. Again, we're talking about chronic otitis media. Culture and sensitivity, antibiotics, a CT scan and x-rays to determine bone loss. Patient may need to undergo frequent evacuation of drainage and debris in an outpatient setting. Often tympanoplasty is necessary. Cochlear implants. These patients require lots of rehab, and they work better if the patient had some understanding of language prior to the implants. A consent form. When the nurse signs this, she is just verifying the patient's signature. If the patient has questions, they need to talk to the physician about that. The cranial nerves. Remember, cranial nerves 9 and 10. Cranial nerve number 9 is the glossopharyngeal, and cranial nerve number 10 is the vagus nerve. Those control the gag reflex. Oculomotor nerve number 3 and trochlear nerve number 4, they move the eye. And then finally the trigeminal, the V, the 5, trigeminal 5, that is light touch and pinprick of the maxillary and the mandible. CSF fluid analysis. The specific gravity of central or cerebral spinal fluid is 1.007. pH is 7.35. The appearance is clear and colorless. These are all normals. There should be no red blood cells. The pressure, this is important, of CSF is 60 to 150. And there is some glucose, 40 to 70 mgs per dl. Delirium. The acute form of delirium can be reversed. Dementia. They can be delirious while they have the diagnosis of dementia. What kind of changes is happening? That's what you want to look for. Are they sudden? If it's sudden changes, then they already had dementia, then they're probably having delirium. Haldol is the medication of choice for delirium. If suddenly worse, as I said, they may have delirium. Delirium versus dementia. This is what we're just following up again. Delirium is usually sudden onset. There's a test that you can determine if the patient has confusion or delirium, and it's called the confusion assessment method. 4 things they look at. Is there evidence of an acute change in the patient's mental status? Are they inattentive? Can they not stay focused? Disorganized thinking, an altered level of consciousness. Any answer other than alert to altered level of a consciousness, and they're having delirium in this scale. Drainage characteristics. The nasogastric tube, that drainage out of the nasogastric tube is going to be pale yellow green color. Remember, it's from the gastric, from the stomach. Normal drainage is pale yellow green from the stomach, nasogastric. Hemovax, that's wound drainage. Initially, it's probably going to be sanguinous, which is blood red, or serosanguinous, which is serous watery fluid with the sanguinous blood red tinge. A T-tube. T-tube is bile, and it is dark green to bright yellow in color. That's what you expect to find. Dark green to bright yellow in color in a T-tube. The indwelling catheter, that should be clear and yellow. Eardrops, if you're going to put them in for an adult, pull the earlobe up and back. I believe in the child it's down and back. EEG, electroencephalogram. This test aids in the diagnosis of seizures or non-epileptic attacks. An EMG, on the other hand, the surface electrodes, I think that's electromyogram, if I remember right. The surface electrodes are used to test the nerves. This procedure is known as nerve conductive. The test is commonly used to evaluate the function and the electrical conduction of the motor and sensory nerves of the human body. They're going to look for peripheral neuropathy, carpal tunnel syndrome, ulnar neuropathy, Guillain-Barré syndrome, muscular dystrophy, or spinal disc herniation. Eye surgery. The nurse must assess prior to the surgery to see if the patient has at least one good eye, because after the surgery, they're probably going to have a patch on the eye that was operated on. I still haven't put in their eye examination. What is abnormal for the elderly, I will. The gas. If a patient is having gas pains post-surgery, get the patient up and walk them, and then administer pain meds if necessary for the pain. Glaucoma. Glaucoma is a group of disorders characterized by increased interocular pressure leading to peripheral visual field loss. They're going to have tunnel vision. Whereas in macular degeneration, they lose the vision, central vision loss. So remember that glaucoma is tunnel vision. They lose the peripheral field. You got let's see, the patient will receive miotic eye drops. These drops burn, but if they don't use them, they will lose their vision. These eye drops can cause bronchospasms and are contraindicated in patients with COPD. For acute glaucoma, patients requires immediate medication to lower the interocular pressure. Darkening the room for comfort, cool compresses to the patient's forehead, providing a quiet and private space for the patient. The hemorrhagic stroke. This patient is going to complain of the worst headache they have ever had. The herpes simplex keratitis care and teaching. Herpes simplex keratitis is a virus that can cause a corneal ulcer. It's inflammation of the cornea. You cannot use topical corticosteroids. Pain and photophobia are common. A hordeolum, which is commonly called a stye. It's caused by bacterial infective agent. Apply warm, moist compresses at least 4 times a day until it improves. Teach the patient to do lid scrubs if this is a common problem. Sometimes antibiotic ointments or drops are administered. Throw all your makeup eye care products away. Insidious, that means slowly acquired. Insulin can and probably will be given during surgery. A Jaeger chart is used to test the patient's presbyopia. Remember, if someone is presbyopia, they have farsightedness, meaning they can see far away. But if you have farsightedness, you can't see up close. Or another way of saying they are checking their ability to see up close, which is decreased due to their presbyopia, their farsightedness. Latex allergy. Be sure to inform the physician. Left-sided homonymous, that's it, left-sided homonymous hemianopsia. Ooh, that's a tough one. The inability to see the left side of your visual field. Consequently, you would approach this person from the right side. Lumbar puncture. They're checking for meningitis. They're going to need to empty their bladder first. Don't do this if they have increased intracranial pressure. The patient is either going to be side-lying or sitting. Macular degeneration. We talked about that a few minutes ago. I guess I have it on here twice. Don't see it now, but anyhow. Macular degeneration is irreversible central vision loss. There are 2 types, dry and wet. Dry is the most common. The patient may complain of blurred and darkened vision, blind spots, which are called scotomas. Patient may notice unilateral early changes. The patient may not. They may not notice unilateral early changes in their vision if the other eye is not affected. Injections into the eye for wet macular degeneration as well as photodynamic therapy. If the patient has photodynamic therapy, they're going to need to stay completely out of the sun due to the dye injected during the therapy. The Ansler ANSLER, Ancillary Grid Test, is self-administered to detect macular degeneration, and that's a series of cards with lines on them. Meniere's disease and care and signs and symptoms. Symptoms caused by inner ear disease, including episodic vertigo, tinnitus, fluctuating sensorineural hearing loss, and oral fullness. This can cause severe vertigo with nausea, vomiting, sweating, and pallor. It can cause the patient to feel as if they are being pulled to the ground. There's an oral glycerol test is given for these folks. If their hearing improves, then they're positive for Meniere's. Compazine for nausea, Antivert for motion sickness, benzodiazepines for anxiety, antihistamines such as Benadryl can be given. Maintenance drugs for these folks includes diuretics, calcium channel blockers, Valium. They need to be on a low sodium diet for Meniere's disease. Surgery is indicated if the patient has reduced quality of life and threatened unemployment. Patient teaching: quiet, darkened room, avoid sudden movement, avoid fluorescent lights or flickering lights and the television. Keep the side rails up to prevent falls. Keep the bed in a low position. Call for help when they're getting out of bed. Meds are probably going to be given parenterally during the attack, and you also want to monitor these people for input and output. Myopia is nearsightedness. Presbyopia is farsightedness. Myopia is nearsightedness. Outpatient ambulatory center teaching of the patient. Who's driving these people home? You want to make sure they get written and verbal instructions to patient and caregiver, follow-up care, and a follow-up phone call. POAG, primary open-angle glaucoma. That occurs slowly without symptoms leading to tunnel vision. Remember, glaucoma and tunnel vision. The outflow of aqueous humor is decreased in trabecular meshwork. The drainage channels become clogged. Damage to the optic nerve may result. Medications for primary open-angle glaucoma: the B-adrenergic blockers. Yeah, you got it right. The A-adrenergic agonists. They both decrease aqueous humor. They might give them cholinergic agents, which helps open the trabecular meshwork. Carbonic anhydrase inhibitors, such as Diamox or Azopt. These decrease aqueous humor. Or hyperosmolar agents, such as Ophthalmolone. That's a glycerin liquid that increases extracellular. So primary open-angle glaucoma occurs slowly without symptoms, leading to tunnel vision. And they're going to get the different medications: the B-adrenergic blockers, the A-adrenergic agonists. They might get some cholinergic agents, some carbonic anhydrase inhibitors, or hyperosmolar agents. Post-operative areas of concern. I just threw this in there. Thought we might need to know. Atelectasis, which is the alveolar collapse, is the most common cause of post-op hypoxemia. It can be the result of bronchial obstruction caused by retained secretions or decreased ability to cough and remove. Gastric aspiration may cause laryngospasm, infection, and pulmonary edema. Keep the unconscious patient in a lateral sideline position. That's the unconscious patient in a lateral sideline position. Preoperative teaching: turn, cough, and deep breathe is the most important. Remember, if you're talking about post-operative surgery, that is the day of the surgery. Day 1 is considered the day after the surgery. And the second day post-operative surgery, on the second day post-operative surgery, I should say, a low-grade fever would be okay. The patient needs to utilize an incentive spirometer or cough and deep breathe. Remember, presbyopia is farsightedness, and the Jaeger chart is used to determine up-close vision, their up-close vision is poor. So the Jaeger chart is what they're going to test your farsightedness with. A reflex hammer. It's used to test tendons when they are stretched. The response is noted as either from 0 to 5 all the way up to 4 out of 5. 0 to 5 is absent, and 4 out of 5, these people have hyperreflexia, muscle spasms, and so forth. Retinal detachment. It's a painless loss of central or peripheral vision, like a curtain comes into the visual field. That is, she stressed that multiple times. For retinal detachment, they're going to feel like a curtain comes into the visual field. I'm trying to think of a way to remember that easily. The curtain and the retinal detachment. I'll come up with something. Seborrheic blepharitis, or seborrheic, I should say, blepharitis. Care of the patient and teaching. Wash the eyelids with baby shampoo to remove the crusting. Stereoscopic vision. This person is at risk for falls. They can't judge distances. The use of an eye patch can cause the same safety concerns. St. John's wort effects. It prolongs the effects of anesthesia. Now we're going to start talking about stroke. Right-sided stroke, left-sided stroke. Right-sided stroke, they're going to be paralyzed on their left side. Everybody's got that. What you need to remember, though, on the right side is they're going to have spatial perceptual defects. The right-sided stroke, these people are going to tend to deny or minimize any problems. The right-sided stroke. They're going to have a short attention span, a rapid performance. These people, right-sided stroke, they're impulsive. So the guy with the right-sided stroke is going to be impulsive, and he's going to have a safety problem. Impaired judgment and impaired time concepts for the right-sided. The left-sided stroke, on the other hand, obviously they're going to have paralyzed right side, hemiplegia, impaired speech or language aphasias. So the left-sided stroke, remember, left-sided stroke, impaired speech or language aphasias. Impaired left side discrimination. They can't have a hard time telling which is which. These people, left-sided stroke, are going to slow performance. They're going to be cautious. They're aware of their deficits. They might be depressed and anxious. Impaired comprehension related to language. As we said, that impaired speech and language aphasias, and math. And then a lot of outbursts from these patients because they're anxious. They kind of know what's going on. The stroke patient. Aspirin is the most commonly prescribed drug to thin the blood. Labetalol, which is Normodine, is given to the patient to keep their blood pressure low. Instruct that patient to not discontinue abruptly, as this may precipitate angina and or heart failure. A CT scan is the #1 test for stroke, as it can determine hemorrhagic, ischemic, or thrombotic stroke quickly. It can determine which one of those it is.